McLendon, CEO of Recover. And this is Ericka Mizuta, CEO and Doctor of Physical Therapy for Recover. Today we're going to talk about what a patient should know when picking a specialist. But before we get started, don't forget to hit the like and subscribe button. So let's talk about picking a specialist. What is the first thing a patient should know?
So I see a lot of patients come through our office and people are frustrated sometimes because, first of all, they don't have a proper diagnosis, so it makes it hard to know who they should actually go see. So the first step would be having an actual proper diagnosis. So for example, I've had patients come in before and their elbow is killing them, and so they're convinced that they have some sort of elbow problem. But when we examine them, we find out that they actually have a nerve problem that's coming from their neck. So, that's a huge thing, because if that patient has tried to go to an orthopedic surgeon about an elbow problem that they really don't have and it's a neck issue, then they're just wasting their time. So the first thing is to see either a physical therapist or a primary care doctor to try to establish a proper diagnosis, first of all.
And how do you know if a specialist treats the certain area?
That's a good question, because now, I went to physical therapy school 20 years ago. So 20 years ago, a lot of surgeons, they were kind of general surgeons. A lot of them would say, oh, I do shoulders, knees, and hips. They did a lot of different techniques. But now, and especially where we practice in San Diego, these surgeons are specialized per body area and sometimes actually per procedure. So, there's some surgeons that all they do is shoulder, total shoulder replacements, or some all they do is total hip replacements. So it's hard to know that information. So, your physical therapist is going to be a wealth of knowledge because we know all of that. So you could do that. You could ask the physical therapist. Another way is to actually just call the surgeon's office.
Mm-hmm.
If you know that you're looking for, like my dad had a hip replacement and I wanted him to have an anterior hip replacement. So I searched that. I Googled that where he lives in South Carolina. But you could call the surgeon's office and say, does Dr. So-and-so do anterior hip replacements? That's another way to do it. So,
and is there a specific type of surgery too? Do physical therapists know, okay, so this doctor uses lasers or something like that? Is that helpful for the patient if they do it a certain way or use certain tools?
Yeah, it's really helpful because there's certain things, like for example, a partial knee replacement now. It's done by what's called Makoplasty, and so you have to have a special. There's actually only a couple of places you can have it done in San Diego. So when somebody tells me they've had it done, I know exactly which hospital they went to,
and probably which surgeon too.
Exactly, yeah, because there's only a few that do it. So yeah, it could be robotics that they're looking for, but yeah, so not every hospital has that. Same thing with the anterior hip replacement. They have to have a special operating room table to do that surgery. So again, I know pretty much where those patients are going and who did it, because not all surgeons do that type of procedure.
And I think it would be very helpful for a patient to ask the physical therapist these questions.
Yeah, I just had a conversation with one of my daughter's friends, and he's a younger guy that had a Makoplasty, which is a partial knee replacement, and he went through 5 or 6 different surgeons before he found the right one because he didn't realize that. And he just kept, calling orthopedic surgery offices and scheduling an appointment, but he wasted a lot of time. And he said it took him about 1.5 years to get through all those surgeons. And I was laughing because I said, oh, who did your surgery? And I named off 3 different surgeons. And he said, how did you know that? And I said, because there's only a few people that do that. Yeah, and I said, I know where you had your surgery. And he said, yes, that's the hospital. So, yeah.
So it sounds like it's great to ask the therapist. But what do you feel, or how do you feel about Yelp reviews? Is that a good way to find a specialist?
I have mixed feelings on Yelp reviews because I feel like a lot of people that write reviews are mad about something. Mm-hmm. And if you kind of read through those reviews, a lot of the things that people write is, I don't like Dr. So-and-so because I had to wait an hour to see him. Or I don't like Dr. So-and-so because, it took his office 3 days to call me back to schedule an appointment. Or I had to wait, 3 months to get in to see him. Now, unfortunately, these things are kind of standard in orthopedic surgery. Especially when you have a person that's really good at what they do. They're extremely busy. Everybody wants to book surgeries with them. So, their offices are extremely busy. So I personally don't go on Yelp reviews because a lot of surgeons that I send patients to, the patient will wait for an hour, sometimes 2 hours to see that surgeon. So I just make sure I tell people that. Like, honestly, what you want to look for is, if you talk to a physical therapist, I know the surgeons that have good techniques. I know I've seen hundreds of surgeries. The people don't have problems. surgeons are highly trained. I look at their education, where did they go to school. The other thing that's a really good place to look is the California Medical Board website. Like if you're actually really wanting to know what the skill of a surgeon is, if you go to California State Medical Board and you type their name in, if they've had any judgments against them, or if they've been put on probation or any infractions, lawsuits, it's all listed there. It's all public knowledge. You can read through everything. So that's honestly a better place to look at than a Yelp review.
Yeah, it sounds like it. You're not going to find that on Yelp.
No.
Or you may, but
you're going to find people that are complaining about, standard stuff. And there's surgeons, there's a couple surgeons that are great spine surgeons here in San Diego that honestly, their wait list is like 6 months to get in. And so, I tell people that too when I see them for an initial visit. If I think that they need to do a consult with one of those surgeons, I just tell them, go ahead and call and schedule because it's going to take you a while to get in anyway. Do your physical therapy, during that time and try to get as strong as you can. And if it's not working, then at least you have that appointment open. Mm-hmm. The other trick is just to call the office every now and then and say, hey, are there any cancellations?
Yes.
Because it happens all the time. I've had people that have actually scheduled a surgery and then they wanted to do it sooner. And I just tell them, like, hey, get on the cancellation list. And sometimes, like, within that month, they'll get a surgery that they thought was going to be 6 months later done sooner. So, yeah.
And the other thing is, as the patient, bring your iPhone, bring your magazines, because you may have to wait a little bit, but you're going to get the quality care that you need.
And the thing you have to realize, too, is that sometimes, a lot of these surgeons, when they're in clinic days, meaning they're not in surgery and they're seeing patients, they're seeing post-op follow-ups. They're also seeing sometimes people that are coming in for emergency that are just doing a consult. So things happen, and sometimes somebody's going to get put in before you, and you just have to be patient, with them. But like I said, it's more just being comfortable with the skill of the actual surgeon, their education level, and then if the therapist tells you, like, this surgeon's great, and I haven't had any problems with the surgery, those are things that are more important, not necessarily the waiting. I know the waiting gets annoying, but unfortunately, it's part of the game,
So as a patient, do your research, ask questions, and get to the right specialist.